1.
Well, hello, everyone, and thank you for joining today's webinar, Mixed Method Studies. Let's talk about quantitative and qualitative. So today we have two fantastic speakers lined up for today, but first I just want to take a moment to introduce myself. So my name is Manuel Escato, and I am CDTRP's new Patient, Family, Donor Partnership and Education Manager. So for the rest of the 2021 series, you'll be seeing me here. So feel free to reach out to me at any time, and I'll write my email in the chat. So again, anytime, any questions, reach out to me. Now, a little bit of housekeeping rules. So during the presentation, we ask that you do keep your mics and cameras turned off. Following the presentation, we will have time for Q&A. And at that time, we ask that you turn your cameras back on. To ask a question, please unmute yourself and ask the presenters directly. We are recording the presentation portion only, and you'll find it on CDTRP's webpage if you'd like to watch it again or share it amongst your networks. Now, with that fun stuff out of the way, it is my pleasure to introduce our two speakers. So joining us today are Dr. Rhiannon Reed, Assistant Professor of Surgery for the University of Alabama's Comprehensive Transplant Institute, and Miss Alexis Carter, Clinical Research Coordinator for the University of Alabama's Comprehensive Transplant Institute. So Dr. Reed is an epidemiologist and outcomes researcher by training and has been working in transplant health services research at UAB under the mentorship of Dr. Jamie Locke since 2013. Dr. Reed completed her Doctor of Public Health in April 2019 and joined the UAB Department of Surgery as an assistant professor in July 2019. Her research focuses on outcomes for transplant caregivers, living kidney donors, and increasing access to living donation. Her primary interests include mixed methods and intervention development, specifically regarding education efforts to increase organ donation and awareness intervention to reduce caregiver burden. And then Ms. Carter, Alexis Carter, is an outcome researcher and is working in transplant health services research at UAB under the mentorship of Dr. Jamie Locke since 2018. She completed her Master of Public Health in December 2020, and currently her research focuses on promoting educational awareness of kidney transplantation and exploring methods to increase living donation. Her major research interests include mixed research methods, specifically regarding access to care and health disparity among rural, minority, and underserviced populations. So thank you both for joining us today. And with that, I will pass it off to Dr. Reed.
Thank you, Manuel, for the introduction and the warm welcome. On behalf of Alexis and myself and Dr. Locke, we are thrilled to be here and would like to thank you for this opportunity to present to you. I hope that today will be broad enough that you'll feel like you learned something, but also detailed enough in case you are starting to get into qualitative and mixed methods research yourself, that you'll feel like there are some valuable takeaways that you can apply to your work moving forward. I will go ahead and share my slides. Thank you for your patience. We have no financial conflicts of interest to disclose, but we do want to share that this work that we'll report today was funded by several sources. So our objectives today are to introduce you to qualitative and mixed methods in public health research, and more specifically within transplantation. We'll describe some basic characteristics of qualitative and mixed methods research, and then demonstrate how these methods can shed new light on questions in transplantation. And well, if this is a good time, I'd like to take a quick poll of the audience, just to ask two quick questions. Yes. Have you had any experience conducting qualitative or mixed methods research? Everyone could submit their answers now. We'll give you just a moment to do that. We'll let you know when everyone has completed it. This is my first time using the poll function, so. Excellent. Okay, so we do have some experienced folks, and then some of you who have not yet gotten into this, but maybe this will pique your interest today. And then the second question, if you can go ahead and fire that one up, that would be great. And do you have any interest or plans to conduct qualitative or mixed methods research in the future? This is just to give me kind of an idea of how applicable this might be to your work moving forward. Awesome. Okay, great. Well, hopefully you'll learn something from me today. If I do go too fast, please feel free to let me know to slow down. There's a lot of information to get into and a lot of exciting stuff that Alexis and I are looking forward to sharing with you. So with that said, what exactly is qualitative research? Well, John Cresswell is a leading mixed methods researcher who has written many textbooks on this subject, and he defines it as a means for exploring and understanding the meaning that individuals or groups ascribe to a human problem. And it involves techniques associated with gathering, analyzing, interpreting, and presenting of narrative information. Some people like to say that quantitative research helps you understand the what of a problem or a phenomenon, while qualitative research helps you understand the why. And qualitative research is flexible, emergent, and iterative. And it's distinguished from quantitative research in that it focuses on understanding a central phenomenon rather than the relationships between variables. Qualitative research is interested in both the process and the outcomes, and data collection occurs in the field. And data collection and analysis occur simultaneously. When you're putting together a qualitative research proposal, rather than stating a hypothesis, which we're all pretty familiar with when writing a scientific paper or a grant, you would clearly state your research question or questions. And you rarely, if ever, perform a power calculation, which can be off-putting for some reviewers, but proposals using qualitative methods are becoming more and more common and accepted. The key characteristics of qualitative research is that it values the natural setting, where the researcher can both observe and understand people's lived experiences. Data are sometimes expressed in numbers, but more often in words and images. And the study design is never wholly fixed. It allows for an interplay between data collection and discovery. And the researcher's self-awareness is also vital because they both influence and are influenced by the research process. So let's talk for a few minutes about the types of qualitative designs. There's a lot of overlap between the different designs, but they all have the same goal. They just go about answering it in a different way. So first is phenomenology, which focuses on an individual's lived experiences within the world. And it's used to help a researcher arrive at a deeper understanding of a human phenomenon or experience. In this case, it's receiving a heart transplant. So we know a lot about clinical outcomes of heart transplantation, but this Iranian paper conducted in-depth interviews with 11 heart transplant recipients to get some insight about what it's like to live with a transplanted heart. And they identified 6 major themes through this work, and which is important because this is information that can be shared with folks who might be struggling with the decision to pursue transplantation or who have recently transitioned to life with a transplant and haven't yet achieved or appreciated the benefit of their transplant. The second example of qualitative design is grounded theory. And this is the use of inductive methods to develop a theory related to an observed phenomenon or experience. This method has explicit sequential guidelines to help with streamlining the data collection and analysis process. And this paper here is an example of using this method to develop a theory to understand why patients on home dialysis might turn down the possibility of kidney transplantation. From interviews with 7 adults, these researchers identified what they called a core category, or the theory that people who are doing fine on dialysis don't want to mess with a good thing. And the authors concluded that the value of their study was in helping clinicians understand and respect why somebody might choose not to pursue transplantation. It's also information that can be used to refine the education process to address some of the questions and concerns that patients reported early in the process of being evaluated for transplantation. A case study is similar to phenomenology, but it gets a bit more specific about a particular experience or a phenomenon rather than the larger life experience. It's an in-depth investigation of an individual, a group, or an event, and it can be descriptive or explanatory. The authors in this paper used case study to explore the psychosocial outcomes of living liver donors, and their work had valuable insight into explaining why some liver donors have suboptimal psychosocial outcomes, including anxiety about the recipient rejecting the graft, or even feeling unappreciated by the medical system and their own community and social network after they donated. So this study uncovered important areas of intervention to improve post-donation care provided to living liver donors. We next have narrative research, which uses how individuals describe their experiences to understand how it shapes someone's life. It focuses on storytelling. It involves having an individual describe a life experience and the meaning of that experience to them. This 2005 study interviewed 39 living kidney donors to better understand their decision-making process. Through the interviews, the authors were able to establish a 7-step process that potential donors go through when making their decision to donate, including awareness of the intended recipient's suffering, information acquisition, and announcement of their final decision to donate. And the authors decided or concluded that the need for psychosocial support of donors throughout the evaluation and donation process is paramount and can be universally improved. Finally, we have ethnography, or how one's culture shapes their beliefs, behaviors, and experiences. And it studies social interactions, as well as behaviors and perceptions that occur within groups, teams, organizations, and communities. The purpose is to provide a holistic look into people's views and actions. Like this study that was among 162 transplant candidates that were awaiting a kidney transplant, to understand their perception of increased risk donors based on their culture, background, and other social differences. And the authors found that patients desire more information about increased risk donors, and greater education efforts are needed, particularly to refine the terminology that's used to describe risks with these patients. Now we'll talk for a moment about some qualitative methods. And there's 3 main, but certainly not only these 3 methods of conducting qualitative research. Focus groups you're probably most familiar with, which are a gathering of people from similar backgrounds or experiences to discuss a specific topic. And then we have one-on-one interviews, which are important for gaining insight into people's perceptions, understanding, and experiences of a given phenomenon. When we compare focus groups with interviews, focus groups can be great for generating new concepts and can create a more realistic atmosphere, and often allow respondents to feel more comfortable sharing things if they've heard someone else in the group bring it up already. They also allow you to explore consensus or disagreement, which is important for understanding a phenomenon or experience. Focus groups are more bang for your buck compared to an interview when you have a limited budget, but they cannot be as desirable if you have individuals of different rank or position, for example, boss and employee or teacher and student. So in those situations, individual interviews may be preferred. And they're also better for sensitive or controversial topics and for groups that are hard to recruit or are rare. Interviews also allow you to take a deeper dive into your questions, whereas in a focus group, you're trying to balance the voices of many people. And then there are field observations, which are non-interactional with participants and may or may not involve obtaining explicit consent to be observed. When it comes to analysis, as before, there are several options, but it depends on the goals of your study. Content analysis is probably what most people think of when they think of qualitative research. It involves reading and rereading texts and the texts that come from communication with participants to evaluate patterns and summarize the data into categories and themes. One con of content analysis is that it is very time consuming, and you can lose some nuances of communication if you focus only on the appearance of specific words or phrases within your text. Narrative analysis uses people's stories to understand, to help us know if how someone says something is important, but it can be hard to reproduce because of all the social and lifestyle factors that can influence each participant. Discourse analysis focuses on the importance of the actual language used and analyzes language within a society or culture in which it takes place. Grounded theory, I have mentioned before, it's both a type of qualitative research and a method of analysis where you use the data to create a theory about a phenomenon. And then there's interpretive phenomenological analysis, which is understanding an individual's experience related to a major life event. Just like reporting of results from clinical trials, which uses the consort checklist, or an observational cohort study using the strobe checklist, researchers have developed a checklist for reporting qualitative research. And in fact, it was developed by a researcher within the field of transplantation, Alison Tong. The consolidated criteria for reporting qualitative research, or COREC, is a 32-item checklist for interviews and focus groups. And it includes elements in 3 domains: the research team and reflexivity, which is the interviewer's credentials and training if they have a prior relationship with the participants; study design, which includes your theoretical framework, how you select your participants, the setting, and your data collection; And then analysis and findings to include your coding tree, how you derive your themes, and then reporting and checking of your findings. Some journals may require you to describe each of these 32 items when you submit a paper, or if the journal doesn't require it, a savvy qualitative reviewer will probably bring it up. So this is a great tool to keep in mind, not only when you're reporting your findings, but also in the design stage. So you can plan for things like member checking, where you share your major findings with your participants to ensure that you accurately captured what they were trying to say. So now I'll speak briefly about mixed methods research, which involves the use of both quantitative and qualitative approaches in tandem. And it's research in which the investigator collects and analyzes data, integrates the findings, and draws inferences using both qualitative and quantitative approaches or methods in a single study or program of inquiry. What's the rationale for mixed methods research? It allows you to do more than simply collecting and analyzing two types of data, because it provides a more harmonious understanding of your research problem than using either approach on its own. And you can simultaneously answer both confirmatory and explanatory questions with mixed methods research. So what do I mean by this? This fun little cartoon here shows how you can answer questions that ask not only how people behave. For example, on the left, not everyone takes the free ice cream, but also why someone might not want free ice cream based on their previous experiences or their personal beliefs and their preferences. You can do this concurrently, sequentially, or in a nested fashion, and you can prioritize either quantitative or qualitative or both. So I'm going to give a few examples of mixed methods studies within the transplant literature. I'll do that later. Right now, we're just going to talk about a broad overview of each of the study designs. So first, there's explanatory sequential, where you collect your quantitative data and analyze it first, and then you use qualitative data to help explain why this problem that you observed is occurring. So for example, a researcher sends out a survey to all doctoral students at UAB to ask them about work-life balance and their sources of stress in their life. And then she conducts focus groups with a small subset of students to understand what characteristics of their environment may contribute to that stress, or even strategies for alleviating stress. Then we have exploratory sequential, where you collect and analyze qualitative data first, and then quantitative data to test your findings empirically. So in this example, a researcher holds focus groups with families and uses those findings to design an intervention to help parents prevent childhood obesity. And then in the quantitative phase, he actually implements the program and measures whether obesity differs by participating in this intervention. And then there's a parallel design where you collect both your qualitative and quantitative data concurrently. And in this example, a researcher administers surveys to all transplant providers across the US to understand listing practices, and simultaneously randomly selects a subset of providers for individual interviews. An important part of mixed methods research is the data integration, and this can happen in one of four ways. Connection occurs when one type of data links to the other through the sampling. For instance, when the subset of participants for an interview is drawn from the population who complete the survey, and you select those people from that sample based on your findings in the first phase. Building occurs when the results of data collection inform the approach of the subsequent methods, such as choosing what items to put in a survey based on qualitative themes from interviews or focus groups. Merging occurs when the two databases, qualitative and quantitative, are brought together for analysis, when interviews contain questions that are structured similarly to a survey, for example. And finally, embedding occurs when data collection and analysis are linked at multiple points. Data integration could be a lecture in and of itself, so if you have additional questions related to this specifically, I have plenty of resources I'd be happy to share. Then, of course, there are challenges of mixed methods. So primarily time and resources. They're very labor intensive, with time spent collecting, cleaning, and analyzing data. Very specific skills are needed with experienced personnel to effectively collect qualitative data. Many researchers still have questions about the feasibility and utility of mixed methods. It's still seen as new or a fuzzy science for some, and because it's too time intensive, they may not venture into this area of research. But the more opportunities that we have, like this one, to talk about qualitative and mixed methods, the more training we get in this type of research, and the more people who propose qualitative and mixed method studies in grants, the more accepted it will become. So I encourage you to look for additional training opportunities and also formal coursework, which is in abundance on the internet. So now I will discuss some high impact qualitative and mixed methods papers within the field of transplantation to bring this a little closer to home for all of us. This paper by Anthony et al. In AJT in 2009 used phenomenology and semi-structured interviews and found that among a sample of 14 patients, the needs of pediatric heart transplant recipients transitioning to adult care are unique and nuanced, and improved communication is needed to ensure a smooth transition of care. This 2012 paper in transplantation used grounded theory and focus groups in 114 participants to identify community gaps in knowledge of the organ donation process. 2004 paper using grounded theory in transplantation in conjunction with semi-structured interviews among living liver donors found that the importance of understanding the pre-donation relationship between a donor and a recipient in living donor liver transplantation is of utmost importance. Gordon et al. In AJKD in 2018 used a multi-phase qualitative to quantitative design involving semi-structured interviews and surveys. So this is a mixed methods example, where they assessed the attitudes of African-American living donors about testing for APOL1. And they found that while donors were generally in support of testing to learn more about their own risk, transplant centers should provide additional support to address associated concerns about the impact of testing and its role in the informed consent process. Schaffhausen et al. In 2019 did a sequential qualitative to quantitative design with focus groups and surveys. And they found that public reports of transplant center performance do in fact influence the decision-making of patients as they choose where to be evaluated and listed for transplant. And finally, just to highlight a little work from our group, Dr. Locke conducted a study in 2015 where she used the Nominal Group Technique to understand the informational and educational needs of the African-American community as they pertain to knowledge about the organ donation process. This important work laid the groundwork for our group's next big projects. And so at this point, I will turn it over to Alexis, who will tell you a bit more about work that our group has done and is ongoing currently.
Thank you, Dr. Reed. So as stated, I will be providing you with a brief overview of some of our group's work in qualitative and mixed methods research. So pictured here in the center are our UAB Living Donor Navigators. The UAB Living Donor Navigator program was developed from the formative research of Dr. Locke and Dr. Q. This program is one of many initiatives designed to help transplant candidates identify potential living donors with the help of an advocate, who's typically a friend or family member trained to speak on behalf of the transplant candidate. Additionally, the program is designed to help potential living donors through the evaluation and donation process. As such, the Navigator program is the first of its kind to simultaneously address the needs of both the transplant candidate through providing advocacy training and potential donors through providing systems training. Early success of the program showed increases in the likelihood of donor screenings and donor approvals. So the Living Donor Navigator program has also been shown to be highly effective, specifically among Black participants, as prior work by Dr. Locke has demonstrated significant increases in the likelihood of donor screenings and donor approvals compared to white participants. In this study currently being conducted by Dr. Killian, we hypothesize that the success of the LDN program among Black participants is a result of the program's enhanced cultural competency. As such, the purpose of our multi-phased mixed method study was to assess the program's cultural competency by characterizing practices that help Black candidates achieve living donor kidney transplantation with the intent of establishing new standards of practice for living donor kidney transplantation education as a means to mitigate living donor kidney transplantation racial disparities. So we'll go through this quickly by phase. In our first phase, which you see highlighted here, we performed cognitive interviews to test a question that was going to be used in our second phase of the study. And from that, preliminary thematic analyses of the responses we received from candidates, advocates, and donors were presented by Dr. Killian at the 2020 American College of Surgeons Clinical Congress. This analysis resulted in 4 themes of kinship, trust, service, and empowerment, suggesting that the practices in our program might not only mitigate racial disparities in living donor kidney transplantation, but improve participants' quality of life overall. We then moved into the second phase of our study, which is comprised of the Nominal Group Technique, which is a novel formative research method to identify the key culturally competent components of our program in conjunction with the focus groups to further explore the cultural implications of the responses provided. So the question we used in our NGT session was, in what ways could a program like the Living Donor Navigator program help you progress on your journey to living donor kidney transplantation while respecting your values, honoring who you are, and meeting you where you're at? This question was iteratively revised based on the responses received in the cognitive interviews that we previously discussed. So here we're looking at the preliminary results from 2 separate sessions among white recipients and Black recipients. And when asked to rank group responses to the central question based on what they thought our program did well, we can see that the highest ranked responses in the white group were encouraging potential donors to get tested in the class workbook, or essentially responses about the receipt of information and achieving the goal of getting a donor screened. Alternatively, the highest ranked responses among Blacks were giving confidence, feeling comfortable and supported, and establishing personal relationships. In other words, their highest ranked responses pertain to the more interpersonal aspects of the program. We feel that these results are really fascinating preliminary data, and we're looking forward to seeing what our results among Black and white advocates and donors will show us as well. In further analysis of the Living Donor Navigator program, Dr. Reed utilized focus groups to provide a systematic assessment of the delivery and content of the Living Donor Navigator program. Through these focus groups, we identified 4 themes, and they were communication, education, support, and commitment. We also identified several core competencies for advocates, which included gaining comfort with identifying and communicating key information, and educating potential donors about the benefits of donation. Other competencies identified were feeling empowered with self-confidence to perform their role as an advocate, and the demonstration of commitment to actively engage in all classes and learn the skills to perform the role of an advocate. In addition to the identified competencies, we were also able to identify 5 promising practices at both the participant and the program level. Particularly, one of the identified promising practices was the provision of alternative accommodations. In a supplementary secondary qualitative analysis to the work previously discussed, Dr. Reed sought to understand whether the Living Donor Navigator program adequately met the needs of advocates who also served as the caregivers. We identified 1 overlapping theme, which was support, and 2 new themes, which are quality of life and fear, that were specific to our caregiver advocates who also served as advocates for their potential transplant candidates. The identified themes, competencies, and the promising practices not only revealed the participants' openness to alternative settings, including telehealth, but highlighted the potential for refinement of the program's content and delivery, as well as cultural sensitivity and an opportunity to provide caregiver support. So utilizing the many analyses of the Living Donor Navigator program and programmatic refinement opportunities, specifically the provision of alternative accommodations, we will explore the implementation of telenavigation through the expansion of the Living Donor Navigator program. Pilot is an NIH-funded R01 research proposal aimed to mitigate geographical disparities in access to the Living Donor Navigator program. In this study, we plan to perform qualitative assessments to identify factors that will facilitate participation in the Living Donor Navigator program via telehealth, utilizing cognitive interviews and formative research tool Nominal Group Technique. We have already begun very preliminary assessments, testing our proposed NGT question in the cognitive interview setting. Additionally, we will implement a telehealth version of the Living Donor Navigator program, leveraging the existing infrastructure of the Alabama Department of Public Health. And pictured here to the right is the classroom setting at one of the ADPH facilities. In this phase of the study, we will use mixed methods to demonstrate the fidelity of the Living Donor Navigator program, irrespective of location. Lastly, we will utilize an individually randomized group trial to compare the effectiveness of the Living Donor Navigator program via telehealth. We would like to thank our team at UAB, Transplant Epidemiology and Analytics in Medicine, and our mentor, Dr. Jamie Locke. We'd also like to thank you all for the opportunity to provide you with an overview of qualitative and mixed methods research in transplant, as well as the opportunity to display our work. We'd be happy to take any questions that you may have.
Well, thank you both for that fantastic presentation, very informative. And I just gotta say, great slides, like very well done, laid out and easy to read. So I just wanna invite everyone now to turn on their cameras and unmute yourselves to ask the presenters questions directly. And just a reminder that this portion is not being recorded. So we're good to go.